Hi, good morning everyone. Today's lecture will be about infection control in the dental office. My name is Ahmed Al-Marashi. I am a lecturer at the University of Basra, College of Dentistry. I'll give you um, these lectures which is related to the infection control and also the management of patients who have systematic disorders. There are two most important pieces of knowledge in any conflict. So we have to know the identity of the enemy and also the enemy's strength and weakness. And by understanding this, the dentist can make rational decision about infection control. So if we understand the pathogens and how it can be easily transmitted from one patient to another, if we know how it can multiply and spread on services, then we can make logical decisions about the infection control in our dental offices. We have two terms, sterilization and also disinfection. What is the difference between sterilization and disinfection? Sterilization is the process that leads to a status of freedom from variable form of microorganisms. Okay? While disinfection stands for the process of prevention and multiplication of microorganisms. It's two different terms and we will use it in constant in our dental clinic. For example, the instruments we used for each patient needs to be sterile, while the services in our clinic it should be regularly disinfected. Disinfection also have substance that can be used. These are can be either antiseptics or can be called as disinfectant. Antiseptics are applied to living tissue, for example, the skin. Antiseptic, for example, that we regularly use is the mouthwashes, like chlorhexidine mouthwash, Listerine. These are referred to as antiseptics. Povidone iodine, the betadine, is used for as an antiseptic for the disinfection of the skin. On the other hand, disinfectants are restricted to be used on inanimate objects. For example, the solutions we used for disinfection of the floor of the clinic, for the disinfection of the dental chair, as referred to as a disinfectant. There are different methods that we can use for the instrument sterilization. In general, they can be classified either into a physical method or chemical methods. A physical method can utilize, for example, heat for sterilization and can be either use a dry heat or moist heat. Chemical sterilization, on the other hand, can use special chemical compounds. For example, in this instance, we have the ethylene oxide gas. So we have many methods that are available for the instrument sterilization. We have the ethylene oxide, for example, sterilization. We have the moist heat, the autoclave here, and we have the dry heat oven. So there are different methods for the instrument sterilization. But are they reliable and are they practical? The effectiveness of sterilizations can be measured by the ability of this method to destroy the bacterial spores, as the bacterial spores is the most resistant form of the uh, of the pathogens. So we are going to compare this method in between to know which method is best to be used in our dental practice. The first one is sterilization by dry heat. Sterilization by dry heat can be done by using an oven that is specifically designed for to be used for sterilization, of instruments. This is the most common method because the the device we used for the sterilization process, which is the oven, is the cheapest one among the others. It has the advantage to being easy to use and affordable, as we said, because the instrument is cheap. But on the other hand, it has some disadvantages as it can damage the heat sensitive instruments, like for example the plastic instruments, and the process of heat sterilization by dry heat, it can take long periods to complete the cycle. So the clinic needs to have multiple sets of instruments, as one set will take considerable time within the oven for being to be sterilized before being reused. On the other hand, we have the moist heat. This is more efficient method than the dry heat because moist heat will use water, and water can conduct heat better than air. When we apply a pressure on the water, the boiling point of the water will be raised. So when we use a device that utilizes pressure and heat to generate steam for the sterilization of an instrument, under the pressure, the boiling point of the water will be raised, so the generated steam will have more stored energy when generated. So when we apply the pressure on the water and then we raise the temperature, the boiling point, as we said, will be raised, so the stored energy within the generated steam will be higher. Once the steam came in contact with the instrument, it will immediately release all this stored energy, and this will be better in this instrument sterilization. The advantage of this method is speed and effectiveness, while the disadvantage is it can damage the heat sensitive instruments, and this is relatively more expensive when compared to other devices. Here we have a table that compares the different sterilization temperature and the duration of exposure for the instrument to achieve the sterilization. Sterilization, for example, by dry heat at certain temperature, for example 121, it takes about 6 to 12 hours to complete the cycle. On the other hand, if we use moist heat under pressure, which is referred to as autoclaving, at the same temperature, it takes only 24 minutes to achieve the sterilization. So in comparison of these two methods, moist heat under pressure will be better and more faster for the sterilization of the same load of instrument, but at less period of time. Another method for sterilization is by using a chemical method, which is the gas ethylene oxide. It has a limited use in the dental clinics. The advantage of this method, it can sterilize a large amount of instruments in one load, and also it can sterilize heat sensitive equipment because there is no heat in this method. It's purely depending on this chemical compound, ethylene oxide. The disadvantage of it It is the ethylene oxide that is being used in this method is highly toxic and requires considerable time for the instrument to be aerated to get rid of this toxicity before it can be being used. The aeration of the instruments and the sterilization process might take from 15 hours to up to several days. Due to this limitation, the toxicity and the time, the use of this method in the dental clinic is limited. But the companies that manufacture the plastic instrument usually use this method to sterilize the instrument before being sent to our clinics. So we have a question here. Which part of the dental office needs to be disinfected? Is it the dental chair, the floor, the countertops, the coin of the X-ray, electric sockets? Which part? In fact, all of these parts, every single corner of our dental clinic needs to be disinfected regularly. Exactly, all of it. So all parts of the dental office needs to be disinfected rather than being touched by the patients directly, like the dental chair, or indirectly, because sometimes we do an aerosol generating procedure, like for example when we use the high speed turbine, aerosol will be generated and spread through the clinic. So even if the patient doesn't come in direct contact, but indirect contact from the aerosol that has been dispersed through the clinic might spread and settle on the countertops. So we need to disinfect every single part of our dental clinic. The disinfection can be either done by wiping the surface with towels that is impregnated with disinfecting solution, or spraying the disinfecting solution on the surface, or we can apply a disposable cover on that surface to prevent a direct contact with it. Here we have examples what we usually cover in our clinic. For example, here we have the headrest being covered with a plastic sleeve. Also, we have the handle of the light also covered with a plastic sleeves, the handle of the tray of the instruments, the three-way syringe, sometimes even the tubing being covered by disposable covers to allow it to be covered and replaced in between patients to prevent the direct contact with the patients. Or we can spray the disinfecting solution to disinfect the countertops, for example. Here we have two examples for countertops. We have the one of the right on the right side that is a little bit busy. Okay, have too many tools, okay, on top of it. On the other hand, we have this countertop which is relatively empty. Okay, so which one do you think, the right or the left, that is can be easy to be maintained? The right or the left? Exactly, we have the left side being less busy, so it can be easily maintained. We can easily spray the disinfecting solution and wipe it in between the patient, rather than we need to spray in between these tools, and also we need to disinfect these as well, because aerosol from the procedure we done might disperse into the clinic and settle on these surfaces and might be a source for infection from one patient to another. Preparation of the surgical team. The operator and the staff within the dental clinics need to be prepared for every dental procedure. Starting from the staff dress, the staff can be dressed in laboratory coats, the white coats, or a dental uniforms or a surgical gowns. During these periods, surgical gowns that is disposable in between patients are best to be used. Also, personal protection needs to be done. For example, a head cap, a face mask, and eye protection, which is very important during this period outbreak. Gloves also needs to be used by the operator. The gloves can be either non-sterile, that can be used for everyday procedures, or sometimes for invasive procedures, like for example extraction of teeth, or where there is an oral surgical procedure that involves flaps, bone removal. Okay, then a sterile gloves is best to be used. The hand and the arm of the operators need to be prepared by hand washing. Hand washing of the surgical team can be done by following these steps, starting from wetting the hand with warm water, applying enough soap to cover all the surfaces of the hand, and then we start what is referred to as the 7 steps for hand washing. We need to rub the hands palm to palm, and then rub the back of each hand with the palm of the other and in between the fingers. And also we need to rub the palms of the hands one to another, and then in between the fingers, and then this is finger interlocking. Then we need to rub the base of the thumb of each hand, and then we clean the fingertips by using a circular motion. And importantly, we need to rub also the wrist. To ensure that we can clean our wrist effectively, any wristbands, watches should be taken out before we doing this procedure. Wedding rings that can take jewels on it, it's best to be removed before doing the hand washing. While smooth wedding rings can be easily disinfected without jewels on it, can be easily disinfected and can be remained during the hand washing. After we've done all these services, we need to rinse our hands with water and avoid touching the tap with our hands. We can either use the elbow or a clean tissue to close the tap of the water. We need to dry our hand thoroughly, and then the hand is ready for using the gloves. The hand washing takes about from 15 to 30 seconds to cover all these services. These services that is important to be washed can be summarized within these 7 steps. So are the 7 steps we are using to disinfect our hands before doing the gloving procedure. Patients for certain oral surgical procedures also needs to be prepared before doing an invasive procedure. Preparation can be done for the oral mucosal surfaces and also for the skin that the operator come in contact with. We also need to give our patients an eye protection and sometimes even a head cap and a towel to cover their chest. For invasive procedure, these towels need to be sterile and single use at all time. Preparation of the skin can be done by using the povidone iodine antiseptic solutions, while the preparation of the oral mucosal surfaces can be done by using a chlorhexidine mouthwash. The use of chlorhexidine mouthwash will minimize the bacterial load within the oral cavity. So any procedures that might cause an aerosol that is generated during the procedure, the generated aerosol in turn will have less microbial load when we disinfect the patient's oral cavity. Preparation of the patient's skin and the mucosa are usually indicated when we have an invasive procedure, as we said. For example, if we have extraction of teeth, if we have a procedure that might involve bone removal, flap elevations, it's best to disinfect the skin and the oral cavity before doing the procedure. This is an example of an oral surgical procedure. We notice that the operator and the assistants wearing a surgical gowns, face mask, eye protection, head cap. We also can notice a disposable sleeves that covers the suction line, and also both of the operator and the assistants wears a surgical gloves for the procedure. These are the references that I have used for this lecture. You can go through and have a look on what we have just said. We have the Fragiscus oral surgery, published by Springer, and the Contemporary of Oral and Maxillofacial Surgery. And also you can go for the National Health Services website about how to wash your hands. Thank you.